Hey everyone, and welcome back to the Complete Health Australia podcast. My name is Teshan. So today we've got a very different style podcast today. So we've actually done a pre-recorded interview with two special guests, one being Dr Viraj Kariyawasam and the second being the CEO of Clinic to Cloud, Rafiq Habib. Clinic to Cloud is the practice management software that we use at Complete Health Australia every single day. It helps us streamline our practice operations to help with our practice billings and to overall provide the patient a better experience.
Welcome to the CHA podcast, and today I've got Rafiq, the CEO of Clinic to Cloud, which is the medical software that we use, and it's unique in the way that it's a medical software that's run in the cloud and also has got significant patient engagement. And we thought that it might be a good idea to talk about why we decided to use Clinic to Cloud as well as what's the advantages that the patients have and doctors have, and how we are utilizing Clinic to Cloud to improve the patient care that we give to our patients. Welcome to the podcast, Rafiq.
Thank you, Viraj. Thanks for inviting me. It's a pleasure to be here. Complete Health has been a partner of ours for a long time now, and it's been a privilege to work with you and progress your development, and continue to hear your feedback and support your practice and watch the practice grow significantly over the past 2.5 years. So thank you for having me.
Yeah, I think one of the main things that we want to talk about is that how this digital platforms have helped us to face COVID, and in the face of COVID, how the practitioners are working through this. And I can talk about how we have done things, and then you can explain to us how the future would be and what you think the future would be. When COVID came, that it was a shock to everyone. I mean, nothing that we've expected that we'll face in our lifetime, but we were very quick to adapt, and we had systems in place and things in place that we could still continue to give the care to our patients. We started going to telehealth straight away. We make sure that the patients who needed to come to the practice were able to come to the practice safely, from their safety and from our staff safety. We implemented hand sanitization across the practice. We had face masks available for patients, and which is why we are wearing face masks even now, because adhering to health guidelines, so we are a little bit closer than what we should be. And the same way that we made sure that the patients are aware of any we used to check the patients, make sure they had a questionnaire done before they come, and also recheck them when they come. So we had a lot of patients telling us that they felt safer coming to our practice than going to Woolworths, which was a really good positive to us. And at the same time, the patients were given access to certain things, so they could do all their contact information filling up at home. They could see their letters at home. They could see all the investigation results at home. So they had the communication still happening in a much more closer way, and also through digital access. And I think that's where Clinic to Cloud was helpful to us.
Obviously we experienced the measures you put in place on the way in today, and the girls were very careful about taking our temperature, sanitizing, the mask is on. So obviously that gives you a level of comfort coming into a medical practice. But from a patient engagement perspective, we speak to customers, but you're one of the visionaries that decided to adopt cloud technology for patient engagement early on. So you adopted it well before COVID. So you were ahead of the curve in that respect, and you were prepared for the patient engagement piece, for the agility piece. Mm-hmm. And as your practice grew, and we've watched it grow significantly. I remember when it was just you. How many staff do you have now? How big is your group?
So we've got about 20 consultants across about 11 to 12 specialities.
Wow. Okay.
And we are growing, and we are getting 3 other specialists from 3 different specialities joining in the next few weeks.
Yeah, so managing a group of that size, and then not to mention admin staff, nurses, allied health professionals across the group. So managing a group that size in terms of scaling your business, in terms of staying connected to all those people, staying connected to your patients. So you obviously thought you saw the opportunity of partnering with somebody like us. We're grateful for that. And you saw that opportunity and you jumped on it much early on. So I feel like when COVID hit, you were a lot more prepared than the average bear.
What do you think the healthcare is going to be like? I mean, the healthcare for future, like where would we end up? Because COVID has changed the way we do. I mean, like the new normal. What is the new normal for healthcare? What do you see?
A lot more patient engagement. So as you know, I normally speak about 3 key pillars in the healthcare space. When we first started, we were very focused on the clinician, right? And we will never discount from that. So the clinician is still core to the healthcare sector. So empowering the clinician with information when they need it, so that your mobile app, if you get a call in the middle of the night, or if you first thing in the morning you want to know who your first patient is, whether or not you've seen them before, which location, in your case, because you've got multiple locations, you've got multiple clinicians. So that information at the point of care is critical in my opinion, and we will continue to push the envelope on that front. The second one is the patient engagement piece, and COVID has accelerated that discussion, the digital health discussion. You know, anyone who is sitting on the fence about whether or not to engage the patient remotely will now have a very different view on it, right?
Exactly.
So, but listening to our customers, the problem is not just the video consult. Customers say, you know, we want a good video experience, like, you know, we want to use CoView, or some want to use Zoom, some use FaceTime, some pick up the phone, they don't want the video. So it's a personal choice. But what is missing out of the experience is the initial patient engagement piece, which is allowing the patient to register, allowing them to put their details, their next of kin in case of an emergency, their Medicare card details, asking them a few questions before they present. So that engagement piece, and then on the back end of the consult, the ability to bill the patient and to give them visibility around the financials, their Medicare card, the Medicare rebates or their health fund rebates. So that was a missing. That's what our customers are asking for. So we have some of that already, as you know, because you've been using it for years. But we will continue to grow that piece. The third one, in my opinion, and the most important pillar in making one of the best healthcare systems in the world, Australia, making it better, is interoperability, and that means connecting platforms to each other. So connecting Complete Health into the private hospital down the road.
Yep.
And so on and so forth.
Yeah.
So that we can create a single episode of care, creates continuity for the patient, reduces the stress, anxiety from a patient perspective, the risk, and it protects the clinician.
I think one of the main things that the patients are beginning to understand about the My Health record, and a lot of people are talking about that, and just a timeline point of view, is Clean to Cloud going to be joining My Health soon?
Correct. So we're actually in the final stage of being approved. So we were on the selected list of vendors. We've done all the work. It's just going through approval at the moment.
Yeah, because I think for me, like you said, healthcare is going to change. Healthcare is going to change to include digital or remote healthcare going to be part of it. So that actually gives that's a very good thing, because we're already providing telehealth to some rural communities, because we clearly know that the rural communities are disadvantaged in this health landscape in Australia, purely because they don't have access to good specialists, good services, and this has made us much more able to reach out to these communities, and I think healthcare will change, because the way that the practices or the doctors work will also change. The timing will change. It doesn't have to be an 8 to 5 job anymore, and the weekends doesn't need to be completely shut for in a specialist healthcare environment. And I think it's going to be much more patient-friendly healthcare in the future. And I think the COVID has done some good, positive changes as opposed to negative changes. And you rightly said that some people don't or cannot engage in remote healthcare purely because of their age, their lack of ability to embrace technology because they're not technology savvy. So there will be a group of patients who will need to come to the practices, or we will need to see in person, and that's where having all these health protection mechanisms that we have employed in our practices is going to be making patients feel safe and okay to come to the practice and not to avoid going to the doctor. So definitely, so I think like the healthcare is changing, but I think it's changing for better.
Well guys, I hope you enjoyed the video. Special thank you to Dr Viraj Kariyawasam and Rafiq Habib from Clinic to Cloud. Thank you very, very much. A special mention to Roshan Karnaratna and the team at Clinic to Cloud for trekking all the way down to our Rouse Hill clinic to record the interview and to have a catch up as well. It was great to see you guys again. Guys, please like and subscribe. Share the video with your colleagues and your friends. And lastly, don't forget to follow us on our social media. So we're on LinkedIn, we're on Instagram, and we're on Facebook. Thanks again guys, and see you next time.